Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Afif Bilal Asif from Vancouver, BC, and my presentation will be about pericardium effusion and its connection with vaping. Before we jump into pericardium effusion, let's take a step back and see what exactly a pericardium is. The pericardium, also known as a pericardium, is an outer protective cover or membrane for the heart and vessels located behind the sternum, which is the breastbone. The pericardium surrounds great vessels such as the aorta, which is the largest artery in the human body, pulmonary veins, and both superior and inferior vena cavities. The pericardium is made of four major layers. The fibrous pericardium, which is the outermost layer made from thick tissue and connected to your diaphragm. The diaphragm is a thin skeletal that separates the abdomen from the chest. The fibrous pericardium holds your heart in place and protects it from infections. You can compare a fibrous pericardium to a peel of an orange, which its main cause is to protect the orange from germs or bugs from the outside. Next is the serous layer. The serous layer is physically much closer to the heart and therefore it helps lubricate the heart so the heart can beat safely without causing friction between tissues. The serous layer then divides into two more layers known as the parietal layer and the visceral layer. The parietal layer is a secondary fibrous layer and the visceral layer is a secondary serous layer, also known as the FPSV in short. Here is a zoomed enlarged diagram of the pericardium from a skeletal point of view, showing the visceral layer, the parietal layer, the fibrous layer, the serous layer, and where they exactly are located on the heart. The myocardium itself is not exactly a layer of the pericardium, but actually the muscle tissue of the heart, and therefore I didn't add it as a major layer of the pericardium. And the pericardial fluid, which I'll be talking about later in my presentation, is the main cause of the pericardium effusion. Now that we have a brief understanding of a pericardium, let's examine exactly what pericardium effusion is. A pericardium effusion is a very serious cardiovascular disease that occurs in the heart. The pericardium effusion is caused by the buildup of extra fluid around the heart. In more context, the pericardium usually has a small amount of fluid that's between it, but when too much fluid spreads, it reduces the friction between layers and causes the heart to go into pericardium effusion. How does it affect the human body? Usually, in most cases, if there is a small amount of excess fluid, which is common, it isn't exactly a problem. But what is special about the pericardium effusion is that too much fluid will result in your heart expanding irregularly. If the heart expands improperly, the blood flow for the entire body will severely decrease. This means oxygenated blood supply to the entire body will also decrease, causing the body to slowly fail. An example I can supply you with is this enlarged picture of a heart, where it shows you the difference between a regular pericardium and a pericardium effusion. As you can see in these models, how the heart on the right looks like a water balloon filled with too much water that's about to pop, and the heart on the left shows a tight, compact heart. By now, we are all probably thinking about how exactly the pericardium effusion is caused. Some possible common reasons where excess fluid is in the heart can be caused by may include diseases that cause inflammation such as lupus or arthritis. Other reasons are cardiovascular cancer, respiratory cancer, infections in the pericardium, immune system problems, allergic reaction to medicine, injury from medical procedures such as open heart surgery, radiation, kidney failure, and metabolic problems such as isoniazid and phenytoin. Symptoms of pericardium effusion may consist of shortness of breath, chest pain or pressure, nausea, trouble swallowing, fainting, increased heart rate, enlarged veins in the neck, and pain in the abdomen. Very severe symptoms, however, may include dizziness, cool feeling in your body, clammy skin, weakness, pale skin, minimum urine, very low blood pressure, and nausea and vomiting. All of these symptoms are also symptoms of shock, and immediate medical help should be provided when feeling any of these symptoms. The only possible ways in today's medical history to discover if you have pericardium effusion is from the following ways. A chest x-ray, more specifically a heart anatomy or imaging of the heart. Echocardiogram, which is the analyzation of the heart and the heart's movements, and a high-frequency examination of the pumping method of the heart. And finally, the electrocardiogram, which is similar to the echocardiogram, except the electrocardiogram focuses mainly on the functions of the heart, such as the rhythm the heart beats at or other electrical activity in the heart, such as a muscle that pumps blood for the body. Every year in Canada alone, an estimated 225,800 Canadians get diagnosed with cancer, and a study showed that 86% of symptomatic effusion patients died from pericardium effusion, and patients who suffered from HIV and symptomatic pericardial effusion had about 36% chance of survival in 6 months, and in a year they would have about 19% chance of survival. Medicine provided to aid would consist of glucosamine, corticosteroid, endomethacin, and plenty more such as aspirin. All of these medications, however, were not the cure, but their main function was to lower the inflammation and hope. In most cases, open heart surgery is the only option if medication fails. The surgery itself's main objective is to use a needle and slowly drain out all the excess fluid without damaging any vital vessels or tissues in the heart. This really puts us in perspective on how severe this disease is, and it can happen to anyone. To make causes worse, the younger generation is severely damaging their lungs by vaping. Vaping is a huge factor in causing lung cancer, and lung cancer is a huge factor in leading into pericardium effusion. From a mathematical scientific point of view, an experiment was conducted in a lab where a group of 40 mice were exposed to vapes containing nicotine for 54 weeks. After 54 weeks, 22.5% of the 40 mice had developed lung cancer, and 57.5% of the mice had developed precancerous cells, and the other 20% had a slight damage but overall had no cancerous cells. In short, 9 out of the 10 developed lung cancer, 23 out of the 40 were in the early stages of lung cancer, and 8 out of the 40 overall remained fine, with slight damage. As lung cancer is a type of symptomatic effusion, our generation is ruining their lives and causing a great likelihood of receiving pericardial effusion and many other dangerous diseases that may occur in the heart or respiratory system. My presentation overall shows one single disease in depth out of hundreds that may be created by vaping. This effect is a worldwide issue and many of us have seen it in perspective, whether that being at school, the general public, or even at the mosque. I plan to expand my knowledge into further areas of the respiratory system and cardiovascular system that may be affected by the outcome of vaping. Jazakallah for taking time out of your busy days to listen to my presentation. If anyone has any further questions, you can email me, call me, or text me on the services I provided. I'll be sure to answer any questions anyone has. I'd also like to thank SlidesGo for this amazing template that I could use for my presentation. On the following slides are located my sources that I use for my presentation, and also the websites I use for the images and experiment. Jazakallah.